launched the Parkinson's Initiative with Michael J. Fox and the Parkinson's Institute out here. And we have individuals with Parkinson's were given a discounted version of the 23andMe. So we've designed the 23andMe site so that individuals can get access to their data. They can fill out surveys specifically about Parkinson's as well as about their general health. And they get all the other access, so information about their ancestry. They can connect and share with individuals. There's a community portion. They can learn from people. So we want to have a really engaging experience for people so that we can keep getting information from them. So we have one Parkinson's survey now. We will plan to have additional Parkinson's surveys because the long-term goal is how do I get information about you today? But let's say I want to know how does your Parkinson's progress in 12 months, in 24 months, in 48 months, because that information will be really valuable to correlate with your genetic information. So then comes in 23andWe. On the back end, our researchers in-house are actually analyzing all the data. So all the information that we're collecting through the surveys, they then compare with the genetic information. And what we're finding is we're actually making really interesting discoveries. So on all the different questions that we're asking about. So we'll hope to announce soon information about, because this Parkinson's community came together, what are some of the discoveries that we have made? And what are those discoveries? What kinds of discoveries will benefit that community? So that might also integrate with a lot of the clinical trials that are happening, where clinical trials are happening, either on drugs, where we can potentially help figure out why some people respond, some people don't respond, where there's toxicity or there's not toxicity. And a lot of the Parkinson's patients are eager to participate in clinical trials. So we might be able to help make sure that they can find a clinical trial that makes sense for them. I think the biggest problem in clinical trials is that they're underpowered, and that fundamentally the studies are just too small. And they're designed in such a way, because they're so expensive, they're designed in such a way that there's a small cushion. And so they're expensive to run. If you need 1,000 patients to really get the power that you're looking for, maybe you have 1,100. But what we're finding is that those actually are still underpowered. So the advantage of 23andMe that we can do is we can actually have huge data sets where we're not looking to collect 100 people with cancer or 1,000 people with multiple sclerosis. We want tens of thousands. So the Parkinson's Initiative, we've announced, we have over 3,000 people with Parkinson's in it, which is, on a relative basis, one of the largest cohorts out there now. So we're looking to develop these large cohorts and keep asking questions. I think one of the other advantages that we have is that we can ask these Parkinson's patients about their Parkinson's, but we're also learning about all these other aspects of them. So we ask the general health survey, and then we're asking about commonly used drugs. So, do they get a stomachache when they take Advil? How do they respond to Benadryl? Things like that. So it's a cohort where we can keep learning more and more things from them. I think we're very focused on developing or understanding the relationship between genetics and drug response. And so that could be either on the efficacy side or the safety side. But it's a well-known studies that have come out that said 50% of all drugs that we take have no effect on you. So what we would like to understand is, if you're given a drug, is it going to respond? Yes or no? And is it going to be safe? Yes or no? And that's going to be a critical mission of 23andMe.